Did you know that many patients use their inhalers incorrectly, and this can make their medications much less effective? Whether you're using a metered dose inhaler, commonly known as an MDI or a Symbicort inhaler, using the correct technique is extremely important. If the inhaler is not used properly, most of the medication ends up in the mouth or throat instead of reaching the lungs where it is needed. So in this video, I'll be showing you the correct way to use both the MDIs and the Symbicort inhalers. I'll also go through some of the most common mistakes that patients make and how you can avoid them to get the best results from your treatment. So some of the most common mistakes that patients make include, firstly, not shaking the inhaler before use, breathing in too fast or too shallow, not breathing out fully before using the inhaler, pressing the inhaler too early or too late, not holding their breath before inhalation, not waiting 30 seconds in between puffs, and lastly, not rinsing the mouth after using the Symbicort. These mistakes can reduce how much medication actually reaches your lungs, which lead to poor symptom control and increased breathing problems. So in the next part, we will be demonstrating how to properly use both the MDIs and the Symbicort inhalers.
I will be demonstrating how to use your Turbuhaler. Unscrew the cap, removing the cap. Once the cap is removed, twist the bottom section until you hear a click. Once you have heard the click, the dose has been unloaded. Exhale. Place the inhaler inside your mouth. Inhale deeply. Hold your breath for 10 seconds and blow out through the nose. If the doctor prescribed more than one puff, repeat the steps as demonstrated. Once you have repeated your steps and taken your prescribed medication, rinse your mouth out with water thoroughly to avoid any possible oral thrust.
So I'm going to be demonstrating how to use an MDI. So the first thing that you're going to do is to shake your medication. You can prime your medication in the air a few times to make sure that it's administering. So the next step, you're going to exhale fully. And then you're going to place your lips around this mouthpiece. As the medication is inside your mouth and you're ready to take a deep breath in, you press and you take a deep breath in simultaneously. And then you hold your breath for 10 seconds to exhale through your nose like this. Once you're done with administering the medication, you're going to rinse your mouth with water to avoid any mouth thrushes. If there was more than one puff that was prescribed for you, you're going to wait 30 seconds before you take another puff.